Welcome to those of you in the United States. Happy Martin Luther King Jr. Day. It is a pleasure to be here. We are joined by a fabulous set of panelists. But first, let me introduce a little bit about why we are here today. My name is Erin Canan. I'm the Vice President for Civic Engagement at Bard College. Bard is one of the founding partners in the Open Society University Network, which is one of the hosts for our webinar today. Bard is joined by Central European University and the Open Society Network, focused on developing academic programs, supporting student and institutional engagement across geographic and demographic boundaries. That includes research network classes, academic programs, international mobility, and community partnerships. We're joined today by the Telwar Network to host the webinar. The Telwar Network is an international association of higher education institutions committed to strengthening the civic roles and responsibilities of institutions that has resulted in a global movement of engaged universities. We are joined here today to talk a little bit about what it means to be working at a university post-COVID. And we are joined today by a number of different universities from around the globe to examine some questions related to the public purpose of universities post-COVID, which we hopefully will get to soon. So I'm going to turn the floor over to our first panelist this morning, evening, or afternoon, depending on where you are in the world, to begin. Apendo.
Thank you very much, Erin. My name is Mapendo Minje. I'm currently from Rwanda, the University of Rwanda, where I'm serving as an assistant lecturer and also the founder of the Global Community Partners. In addition, I served on the Telwar Network Steering Committee 2 years back as a student representative. And today I am all the time interested in the movement of the Telwar Network as one of the Rwandan delegates to the Telwar Network different meetings. Well, to start with the new realities at the University of Rwanda is that one of the strategy that the University of Rwanda is actually adapting is to see how to assure education, civic engagement, and also learning processes continue to be effective. However, since the pandemic came during the time the University of Rwanda was offering a face-to-face teaching and learning mode, the University of Rwanda had to shift old mode of teaching and learning currently to a blended system where some students groups stay at home and others come to the campus in shift. And then we are trying to apply different technological models to assure everyone is following the course. However, the challenges which students are encountering so far, I'll be talking about student challenges and also academics challenges and the institution challenges as a whole, is that most of the students at the University of Rwanda, around 80% of these students, they are government sponsored, and they are coming from families which cannot be fully able to equip their children with technological devices such as smartphones and computers. However, the lack of these technological devices has been a challenge in the country, where those students who are supposed to stay home cannot be able to follow effectively the courses being uploaded on the Moodle platform. This has frustrated a lot of students, challenged, and also the challenges on the side of the lecturers is that at the campus, we need different trainings to assure that the lecturers are well able and also apt with knowledge and skills to use the e-learning platform. Remember that the e-learning platform has been then assuring that we upload the module online, the course units, the tests online are effective to assure the students are using these resources.
Lapendo, we're having difficulty hearing you, I think. So I think we've lost Mapendo, so we're going to move to our second speaker. Joanne, are you ready? I'm sorry. I think,
Yeah.
Yes, and hopefully he'll be able to jump back in when he gets back onto his internet.
Yeah, and isn't this a good example of just the challenges in access to online mediums that are experienced more in parts of the world, but we're also experiencing in Canada, particularly with some of our rural areas. So I'm pleased to join you. I'm Joanne Curry. I'm Vice President External Relations at Simon Fraser University and the Institutional Lead for Community Engagement. I'm joining you from Burnaby, British Columbia, Canada, which is on the unceded territories of the Coast Salish peoples. SFU, we're a research university on Canada's west coast with 35,000 students that in normal times study at 3 campuses. And community engagement is really part of our culture and vision, and it informs our institutional commitments, our methods and practices for research, and our presence in places where we work. We were so pleased about a year and some ago to be the lead for a cohort of 16 Canadian colleges, research and teaching universities that are piloting the Carnegie elective classification for community engagement. We're completing the US framework and considering, should we have a Canadian classification system? And if so, what adaptations would be required? And this work that we're doing together it's allowing us to learn from each other and understand the impact of our community engagement in order to improve our practice. Certainly, well, the COVID-19 pandemic is global, and I think we all share the horrendous health challenges, the deaths, and the impacts to our communities. And the health in the very broadest terms of a community has a direct effect on the health of our institutions and vice versa. I've been so impressed with the response of universities and colleges around the globe to the quick pivoting to teaching, learning, and community engagement. And the Talwar series is just a wonderful opportunity to learn about the commitment, the collaborations, and the creativity of institutions as they respond to their communities. And the pandemic has certainly evoked a stronger sense of empathy and volunteerism from all of our institutions. It became clear almost immediately that there were a few really important roles for the universities during COVID. And one of the most important one was supporting public health decision-making and disseminating information to the general public. Our mathematician and disease model, Carolyn Colleen, is on a provincial and national expert task force. She advises our provincial health officer who relies on her modeling, and also has made herself available to media on a constant basis. She's had 1,600 mentions in the media last year with a reach of 1.5 billion people. And hopefully the power of evidence for decision-making and the role of research was a huge proof point during the pandemic. And hopefully we're going to be able to harness this in the future, especially in responding to the climate crisis. I was also really gratified and impressed with the number of our faculty from all areas of the university who made really practical and accessible webinars and videos, and topics such as how to provide support for families with children of special needs, the mental health challenge, and one of my favorites was how to find happiness and joy in these trying times. We did adapt our community engagement practices as many institutions did around the world. And one of the second most important role I've seen for universities is its convening role and also disseminating knowledge to the general public. Our Public Square and Center for Dialogue series had a Distant Not Engaged series, online webinars, and topics such as food security, social cohesion, democracy, anti-racism during the pandemic, and a lot of sessions for youth as well. We also continue to build our expertise and methods in dialogue, and that's going to be increasingly important to reduce the polarization we're seeing in many areas of our society. Our centers published a Beyond Inclusion Guide of public engagement to support equitable inclusion of diverse voices in public engagement processes. So we're learning a lot through the pandemic crisis. We have a better understanding of our relationships with community. And we found that our longest standing partners were the ones that reached out to us immediately because they knew who to reach out to and they trusted us to respond. Local governments called us in particular for public health advice, economic recovery innovations, and to harness big data for their decision making. So at this critical time, we're very sympathetic to the capacity challenges of our community organizations, and I hope we're becoming even better listeners. We have reconceptualized the Carnegie definition, which talks about reciprocity, and we think that's still important, but there also has to be co-creation, and it has to take place and considered over a much longer time frame. Right now, we need to support our communities in any way we can, including community service, to build trust and exchange knowledge. COVID-19, another thing we've certainly seen, along with the anti-racism movements, has exposed the cracks and the gaps. We're part of our communities, not places within it. And we need to advance on our own equity, diversity, and inclusion commitments, but also bring greater visibility, knowledge, and action to these societal issues. We are a part of society that needs to change. And these are some of the areas of the Carnegie Canadian definition we would like to see, such as advancing social justice and equity and inclusion. So in terms of looking to the future, I believe that we're going to emerge from the pandemic with a recommitment to community engagement and a community commitment to their public institutions. Right at the very beginning of COVID in mid-March of last year, there was a moment at our university when we thought, do we need to face inwards and really focus on our core academics? And fortunately, this moment passed very quickly because we really did affirm that commitment to community engagement is who we are as an institution. We do acknowledge, though, it's been very stressful for students financially, mental health, huge workload for faculty who had to quickly pivot to online learning. But our communities have stepped up to support our students financially and with remote work integrated learning experiences. And in fact, last year we received a record donation, an endowment of $36 million for full ride scholarships for equity seeking students. So as a concluding remark, I think we all need to draw attention to the positive impacts of community engagement for both universities and communities, and the important role and continuing role of our institutions, especially with COVID business and community recovery. Better yet, have our community partners speak of the impact, especially to governments and university executives that might be looking to find cost savings. Going back to Carnegie cohort in Canada, it's really allowed us to collaborate and showcase a movement that's happening in Canada with the help of organizations such as Universities Canada and the McConnell Foundation. And Talwar is doing this important work on a global basis. While our institutions have very different contexts, we are committed to our communities and we share the belief communities make us better universities. I look forward to the discussion.
Thank you, Joanne. And I'm Matthew Johnson, the president of Albion College. I apologize for being a few minutes late into the meeting. I seem to have had the bug that passed on to Mapendo, as is the case in these COVID times. Zoom was not working for me to get on, but it is working now. So I did hear all of yours, Joanne, and it reminds me of a few remarks that I'd like to make before we turn to Verity, who is the other representative of the international cohort, before we move on to Leslie. We have been working on an international pilot in both Canada and Australia for the Carnegie classification for community engagement. That pilot, happened to be at the same time as COVID, or COVID happened to be at the same time as the pilot. So what was designed to be an 18-month project is now extending well into its second year. And we'll be moving forward, hopefully, with an Australian classification. We may hear more about that from Verity in a moment, and a Canadian classification in the months ahead. We've learned a lot from collaborating with our international colleagues, and it was amazing to be able to connect with them in the midst of COVID and hear about their very different contexts and how they were responding to the pandemic. Yesterday, in fact, I spoke with the U.S. National Advisory Committee to bring them up to speed on that project and other projects we're doing relative to the Carnegie classification. And we heard again the sort of very bipolar distribution of how schools are responding. We heard that some schools are decreasing their engagement in communities and turning inward, just as Joanne mentioned was a thought for a very brief moment at Simon Fraser, while other institutions are turning outward and engaging even more deeply in their community. And we're happy to say that at some institutions in the pilot, it has been important for them to be in the pilot to be able to articulate to their management and their leadership that community engagement is ever more important today than it might have been in the past. Here at Albion, our response to the pandemic has been broad and deep. We decided to bring students back in the fall as an equity issue because we did an analysis of the impact on students going home in the spring prematurely. What we found was that low-income first-generation students were disproportionately negatively impacted by being at home. So we committed to figure out a way to bringing students back, and we did bring students back live for the fall, kept them safe. We established a testing clinic for our campus, but then also advocated with the state to establish a free public testing clinic in one of our buildings, and that testing clinic is still operational today. We've been working with the state to offer vaccines now that they're rolling out vaccines and doing contact tracing as an augmentation to the public health department. And most recently, we've partnered with the community around some food distribution initiatives for families who are having some food security challenges. So I'm very proud of our institution and honored to be here with you all today in this conversation. And what I wanted to do now is turn to Verity and ask Verity to offer an Australian perspective, another institution who is leading a cohort of schools in Australia in the pilot for Carnegie, as you just heard from Joanne, and then we'll move on from there to Leslie. So Verity, can you take it away?
Yes, I can. Thanks, Matthew. Hello, everybody. My name's Verity Firth. I'm the Executive Director of Social Justice at the University of Technology, Sydney. The University of Technology, Sydney is on the land of the Gadigal people of the Eora Nation, and I'm also sitting on the land of the Gadigal people of the Eora Nation. I'm in my house, not on the university, but I want to just acknowledge the traditional owners and pay respect to elders past and present. So the position of Executive Director Social Justice at UTS was created very deliberately to be able to harness all of the resources of the university to maximise our public benefit. So the job that I do at the university really is a cross-portfolio job that pulls together all parts of the university in a vision to maximise our public benefit. Before I arrived in this job, I was the CEO of the Public Education Foundation. So my career has been in public education, and I was the Minister for Public Education before that. At UTS, recognizing that we wanted to define our mission around maximizing the public impact of universities, we were very interested in frameworks that provided us or provided the university with the appropriate incentives and rewards to encourage both faculty and staff in our mutual endeavour. And that's how we got involved and interested in the Carnegie Project. So the Carnegie obviously is a community engagement classification that's been running for many years in the US, but hadn't yet spread its global wings. And in Australia, we brought it to Australia, where UTS co-led the pilot operation of 9 universities. We deliberately chose universities that were spread in their geographic location and had different challenges and different communities that they were serving. So at UTS, we're a very urban university. We sit at the heart of Sydney. We have big towers that into the sky, and we have a very urban student footprint. So although a lot of our students travel by train to get here, they're still either suburban or inner city students. So we partnered with a range of universities, including Charles Sturt University, which has 9 campuses across regional New South Wales, servicing a whole lot of smaller regional country towns and actually providing a real economic anchor in those towns. The pilot process itself has been really interesting and collaborative, and I think probably one of the greatest benefits of doing the pilot has been doing the pilot. It's meant that 9 universities have really established these relationships. We've been working together. There's no competition between us because we all want to basically meet the accreditation. It doesn't help to knock somebody off the accreditation. So it means that there's been a really collegiate environment, and we've shared practice, shared insights, and had a really good experience that has arrived perfectly to deal with COVID. So COVID in Australia has been a slightly different experience to some other countries because we have actually had a very good public health response. We never had a lot of community transmission in Australia. In fact, at the moment, I think in New South Wales, we've had like 10 new cases yesterday. And there's a whole range of reasons for this. So it's things about public health response. It's a bit about being an island. Australia locked its borders pretty early. But one of the real positives to come out of the COVID response in Australia is that there has been, for the first time in a long time, a real meshing of expertise and government and civil society in terms of COVID response. So in terms of public trust in evidence and universities and medical institute researchers and public health officials, that's actually at an all-time high. Plus, there was a really good example of university researchers working alongside government health officials. This is a real moment in a way for Australian universities because at the moment we're riding high in the public's opinion of us. And that trust in evidence-based expert decision-making is also high, and all of the opinion surveys tell us this. Having said that, despite that, government funding hasn't necessarily followed that path. So despite the fact that public trust is high in universities and expertise, and there is a strong sense of public support for the evidence-based COVID response, the government, faced with all range of COVID-style economic impacts, has decided to significantly cut funding to universities. And this is where I think Carnegie has been very useful. So the government has moved towards I suppose, more restricted funding mechanism for universities, but it has created a new fund. It's created a National Priority Industry Linkage Fund, which was really about how to encourage universities and industry to work more closely together, especially in terms of the COVID rebuild. And because we had such a developed piece of work in relation to the Carnegie, we've been able to engage really well with the government around what partnership actually looks like outside the university environment. So what do really good university partnerships look like? We've been able to use the definition that Carnegie provides us with around mutual benefit and reciprocity, and that understanding that knowledge resides on both sides, both the academic knowledge and the practitioner knowledge and community-based knowledge. full recognition of that as we've talked to the university about what an industry linkage fund would look like. We've been able to lobby really hard around expanding the definition of industry to ensure that it includes community partners in all their shapes and sizes, whether they be large not-for-profits or smaller community-based organisations. So this has been a very important part of our government focus. And it's been interesting because the government had been coming back to us and saying, oh, that's wonderful that you've got a definition. We're really interested in the Carnegie definition. So it's come at a really good time in Australian higher education. Like other speakers on the hookup, COVID did give us a real opportunity to respond more directly to community need as it arose. We, like as Joanne was saying, had all the academics working in different ways with different government advisory organisations and so on. But we also really shifted our community engagement focus to be much more localised and much more into direct relief. So a lot of our student engagement at UTS tends to be longer term. So even our volunteering are longer term placements. We have project work, which is part of course credit. But what COVID delivered us was a couple of problems that we had to solve pretty quickly. The first problem we had was that a lot of our students were in immediate economic need, quite dire economic need, particularly our international students. So our government made the decision that the support packages, the financial support packages, weren't going to be able to be accessed by international students, which meant a lot of our international students, particularly with the retail sector suddenly closing, had no job and no income. For some of our international students, their families weren't even able to get them money because there'd been capital flight measures in their own countries preventing the passage of money out of the country. So we had very needy international students that really were our job and responsibility to help look after. And at the same time, we had the same, as other people were talking about, domestic students from low SES backgrounds who were also facing a whole range of issues, including unemployment in the family and lack of access to technology, both connectivity and hardware. So what do? Well, there was a range of things. We obviously introduced a large student support package where we were directly providing financial assistance through grants and loans, student loans. So that's fine. So we started just doing direct financial assistance. But we also established a community ambassador program, which allowed the university to employ our students to actually work in the community, meaning that they both got a job because a lot of their jobs had disappeared overnight, but we were also helping out with our local community. And we basically dealt with two types of organisations in that program. We worked directly with existing charities, often with food distribution charities who were requiring volunteering work because of their sudden need for volunteer labour. And we're also working directly with community organisations on our doorstep. A really lovely example was we developed a digital inclusion program with elderly residents in the local community who really needed to get up to date on their apps on their phone. And students would go and sit with them and teach them about apps and upgrading their digital capabilities. And that was a really beautiful program. That we were able to support students financially, but also deliver a benefit that had been requested by the community. So I'll probably leave it at that. One of the things I did want to say was that Joanne is right. We were at a crossroads at the beginning of COVID. The financial pressure that universities were under in Australia was extreme. As I said, there was no rescue package from the government, unlike other industries. And a lot of our revenue comes from international student income. So universities were suddenly in a genuine revenue crisis. And being able to continue to do what is often seen as more charity work by the universities was an argument that you had to win internally. You had to actually go into the universities and defend the role of community engagement and defend the role of all of the equity and diversity programs we run. Now, we were lucky at UTS that wasn't a hard ask. The university leadership is already very committed to that program, but it is true to say that it is a area of work that constantly needs to be defended and championed. And that was where Carnegie was very useful for us during this time.
So Verity, are you all set? Is that, it's hard to tell on Zoom whether you're just taking a breath or you're continuing.
No, I'm done.
Excellent, excellent. Well, it's been great to hear from both you and Joanne. For those of you who don't know, they did give you a little insight into the Carnegie classification. It's been around in the U.S. for a little over 15 years, and we've had several cycles in the U.S. There are a little over 300 institutions in the U.S. who have achieved the classification for community engagement. And as we said earlier, we launched the specter of trying to internationalize 2 years ago. Most recently, just before COVID, we joined Talwars in New York City for a meeting of several folks from the African continent, from different countries in Africa in the higher education space. Most were leaders of their institution who were interested in considering whether or not an expansion of the international pilot into the African continent would be wise. And we're happy to say that many of those institutional leaders responded that they did want to expand the pilot into Africa, and then COVID started. So we have not yet had the opportunity to do that. But our next speaker, Leslie Von Roy, is from Stellenbosch, and Stellenbosch was a participant in that gathering and is one of the leading institutions in South Africa working on community engagement. And so I would ask for Leslie to step in and offer your comments. I think you have a slideshow for today as well.
Thank you, Matthew. Yes, indeed. Leslie Van Roy, Senior Director responsible for social impact and transformation at Stellenbosch University. And I am going to share my slides for two reasons. One, it is just after 9:30 p.m. in South Africa, so I need to keep myself straight. And secondly, I'd like to share some data that showcases Stellenbosch's involvement in the local community over the last couple of months. So let me just share it on this side then. I will skip some of the slides, perhaps just something of the overview, and then I'll jump in. For context, South Africa, like a number of countries, have had levels of lockdown. The most extreme form of leveled lockdown is that of level 5, which we found at the beginning of the pandemic. And before mid-December 2020, we were down to level 1. And currently we're back to level 3 in South Africa, given a sudden surge of a second wave in South Africa. And you would see that our infection rates in South Africa has been relatively high. Death rate has been lower, but the infection rates has been high, and therefore the levels of lockdown. And we're supposed to start vaccination processes at the end of January, early February this year. Something of our university and our adjustment to COVID-19 and its challenges is that, of course, we had to start a remote two academic terms remotely, or a semester of online academic learning that we call remote emergency teaching and learning. And this asked of the university to provide laptops to students and make data available specifically for all students, but of course this specifically helps students that come from economically deprived communities to make sure that indeed they continue with the academic process and the learning process could continue. Our academic year runs from roughly the beginning of February until the end of November. This year we'll start a bit later. We had an adjusted academic calendar at the end of for 2020, all South African universities. And we're almost ready to start the postgraduate programs, and the undergraduate programs will kick off by mid-March 2021. Perhaps something about student volunteerism that could continue, specifically from two faculties at Stellenbosch. One is the Faculty of Medicine and Health Sciences, and the other one is the Faculty of Education, for two obvious reasons. As you would know, the medical type of support requested and needed was quite high, and in this regard, our students could help with screening in two of our provinces with the Department of Health, the provincial departments and the national departments, and could continue with data collection programs, food gardens, mask supply, and of course the screening type of necessities in partnership with the province. And we decided to continue with the placement of students. Now, we could not place students in the bigger tertiary hospitals in the province, given the acute the fact that students could not be guided given the acute strain on these hospitals, but indeed we could place students in a number of smaller hospitals in at least 2 of our provinces, and our faculties, 3 faculties have been asked to help to store the necessary vaccines for South Africa, and we hope to fulfill that role. In the Faculty of Education, of course, subject-specific help was needed. Our students and faculty created WhatsApp-enabled lessons to support the education endeavor creatively, given the fact that schools were closed for a prolonged time, and then online teaching and learning started, which again negatively affected the community schools in the economically deprived communities. So that could help. And we have a number of local radio stations, not only in this province, but across the country, and we could make use of the local radio stations to indeed teach, ask teachers to come in and lecturers and students from the university to teach and or pre-record sessions at our university. Stellenbosch is a so-called town university, where our main campus is situated in the town of Stellenbosch, has about 160,000 residents. And in that regard, it is regarded as a town university. So all our collaborative efforts in the town of Stellenbosch is linked to the local government structure. And in the case of the town's response, we co-established what is now known as, I'll come to that a bit later, but Stellenbosch Unite. And Stellenbosch Unite really was established to make sure that under the higher levels of lockdown, we could distribute food, make funding available, indeed with other partners, to make sure that the most dire need in terms of food supply, and making funding available for that could happen. And you see a list of the co-funders and partners with our institution there, and also the criteria. Now, of course, there was a government response in terms of food security, but we realized that that would not be enough, and that indeed we needed individuals and structures, including the local government, the university, and non-governmental organizations, to take hands to make sure that indeed we can make a difference in that regard. Some of the statistics of what we could provide up to now, both in terms of soup, food portions, food partials, and food vouchers, that in South African rand terms is quite a large amount, and it made some difference in at least food security related matters in Stellenbosch and surrounds. Thereafter, we co-started what is called the Support Stellenbosch campaign, and it really was a campaign to support local businesses, medium and small, to make sure that those keep on going. We jointly started a fund to make sure that we could encourage local buying in restaurants, guest houses, the tourism sector, etc., to at least under the previous levels of lockdown, restart the economy and make sure that specifically small, medium, and perhaps also one-person businesses could survive during the most harshest part of first wave. As a town university, we have what we call the Rector-Mayor Forum. The president of the university and the mayor of the town and their executive committees annually meets once a term with 5 joint committees. But under COVID, we realized that we need a more daily type of meeting structure, and we were invited to join the town's Joint Operations Committee with a number of partners. The campus health services were invited to support not only the municipality, but the local structures in health advisory, screening, and testing procedures with the local office or the local hospitals of the Department of Health. And of course, Stellenbosch University made facilities available for government to use specifically for field hospitals and to house or isolate healthcare workers during the pandemic. We could make available some funding, internal funding, social impact funding, to support research and of course also innovative ideas around the printing of masks. The national program for the building of ventilators could be supported directly. And here's a photo of a robot-linked iPad device that we used in the university's tertiary hospital, still used in the university's tertiary hospital, to support the Department of Health and the local hospitals. And perhaps some closing remarks. It was quite important for us to, as a town university, join hands with the local structures, faith-based organizations, NGOs, not-for-profit structures, the municipality, and the new structures that we created. There's been a fantastic journey with two provincial departments, that of the Department of Health and the Department of Public Works. And in that sense, I must agree that the relation between university, provincial departments, local government and structures is on an absolute high. The university is regarded as an anchor institution, and we regard ourselves as quite humbled to fulfill that role in the context of Stellenbosch and the context of our province. The collaboration with non-governmental organizations continue, also a much better hold, and it is fantastic that we could restore relations. We're very fortunate that we've not had budgetary cuts and that we could reallocate institutional funding to support the local community and, of course, support students on a variety of levels. And in that regard, it's fantastic that we could solidify our commitment as an engaged university towards the local community and support government on a provincial and national level going forward, which I think is an honor and a privilege for all universities in South Africa, that during the most harshest and most difficult times, institutions of higher learning can fulfill that role. Matthew, thank you. I'll stop sharing here and we'll take questions later. Thank you.
Excellent. Thank you, Leslie, very much for that informative look at how things have been unfolding in the South African context. I think we might have Mapendo back on now. Is that so? Mapendo, are you able to reconnect?
Yes, I can still be able to reconnect. Yes.
Excellent, excellent. So without too much further ado, then Mapendo, I would invite you to continue where you were, explaining the responses in your location and how you have been navigating through COVID.
Thank you very much, Matthew Johnson. So to continue, I'll just saying that the University of Rwanda has been really struggling to assure that the teaching and learning processes are ongoing. And also talking about the civic engagement, well, of course, we have regulations that are restricting, students to meeting local people. And these restrictions also become really a very big challenge for civic engagement. However, there are different student movements which have been ongoing, where students have been serving at the international airports. These are students from the medical education, the College of Medicine and Health Sciences, to assure that they are learning and also serving the country during this pandemic threat. Besides that, students are also being deployed to different health centers where they are learning from the different COVID cases.
Oh, it seems like we may have lost Mapendo again. Seems like we have. So I think Mapendo, are you still there?
How they can learn from the different cases of COVID and also serving. However, some other movement of students to talk about civic engagement, they are trying to engage with local people by providing food and also hygienic materials. So to say, the University of Rwanda is trying to assure that the teaching and learning processes is really ongoing, and also depending on the strategies being put forth by the country to restrict. It has also been a problem to the civic engagement sector here in Rwanda. Currently, by this time I'm talking, the government of Rwanda has locked down the city of Kigali and also restricted the movement from district to district and also to the city of Kigali. So it means that universities in Kigali have just been closed. Starting tomorrow, they will not go to school, and online system have to also continue. However, as I just said before, empowering the system. The e-learning system is one of now the priority of the University of Rwanda to assure students are being sponsored by the government to have electronic appliances to access resources online, and also to see how lecturers can also be empowered by training to assure that the e-learning is being used effectively. So this is how we're adapting the COVID time in Rwanda, the University of Rwanda in general. Thank you.
Thank you, Mapendo. I'm so glad that you were able to reconnect and share with us about your context. I think now what we'll do is we'll open it up for questions for any of our panelists. And I'm happy to repeat questions as they appear in the chat, or people can jump in and ask questions verbally if that would be their preference. So the floor is open for questions from our panelists. Give folks just a minute to see if they want to ask any in the chat. I see a question that has come up. What do you feel are the greatest opportunities and challenges in the coming period? That would be as we start to move out, hopefully, of COVID. And anyone can take that.
I think it's an opportunity, if done correctly, to build, well, what Joanne referenced, which was there's this growing sense of community spirit and collaboration that has emerged from COVID. And I think we have an opportunity to seize upon that and sort of ride that wave. And to a certain extent, that'll be a choice of civil society and government to ride that wave. It can be forgotten or it could be remembered. And I think universities can play a really good role in that. I think because governments will be so focused on job creation, and well, this is what's happening in Australia anyway, governments are so focused on job creation that the way that they're now beginning to fund universities is around a range of programs to encourage more of a narrow technical skills base to move people into employment quickly, which is well and good. But I think the role of the university can be saying, excellent, good on you, but there's a whole range of other 21st century skills that our students need. And those skills are things that are best taught at a university through engaged learning, and those sort of democratic capabilities, for want of a better word, the capacity to question, the capacity to think, a knowledge of systems, history, and sociological understanding, and also that capacity to work across difference. So keeping our universities diverse and inclusive places at the same time as having the course content and curriculum that really teaches people a way to question how things have been and to question authority, or to understand how collective action can be made. So, and the way I think that can be done in a way that isn't as threatening to government as that could potentially sound is to say all of those 21st century skills that you talk about, like creative thinking and collaboration and critical decision making, all of those are best taught in an environment of engaged learning where people are learning in community with purpose, or in collaborations with not-for-profits and so forth. So there's a double whammy of how those skills are best learned.
Thanks, Verity. It looks like Joanne wants to jump in on that question as well.
Yeah, I think the continued uncertainty because of the vaccine rollouts and the different strains are just going to continue to strain our system. But I think the two opportunities that I hope we, even in this period, we look towards, and one of them is further collaborations across our sector, but let's say I liked all of the new partnerships that your university has undertaken. So those, continuing to build those will be important going forward. And again, this narrative, it's been a stark example. And Matthew, you could talk more about this in the States. There's always these town gown issues, but when there's no gown, the town really hurts. And so I think there's some really interesting things to talk about the role of our institutions in our economic recovery, because sometimes I think we get left off the table in those discussions of business recovery.
Yeah, that's actually very, very pertinent to the current moment here in Michigan. The governor has recognized that the institutions, and particularly the small institutions that are in smaller towns, really are the anchor institutions for those towns. And so we've had some pretty productive conversations with our state officials to differentiate between the large institutions and the small institutions, that we can respond in different ways, that we are more embedded in our communities in many ways than the larger institutions are. And so those have led to some really fruitful conversations for us here in Michigan. On the other hand, I know in some other states where the public institutions are favored, the large public institutions are favored, and there is cutting happening to some of the state aid that previously would go to smaller institutions to buttress the large state institutions. So it's a zero sum in many ways. You know, as the crisis goes on, that sum gets smaller and smaller, if zero sums can get any smaller. I would love to hear. I have a question in the chat. I would love to hear either of you, or Mapendo or Leslie, talk about what were the important resources that you had in place prior to the pandemic, the infrastructure and the developmental work you'd done as institutions to be ready, so that when the pandemic came, you could shift into engaging in your broader community in the way that either Joanne or Verity or Leslie or Mapendo talked about doing at your institutions. Mapendo, you're muted.
If I can give an example here back home, is before the pandemic struck at the University of Rwanda, we had computer laboratories, and also we had big rooms where we could have, you know, a mass or meetings. And when the COVID pandemic struck in, we could now use it, but also for teaching, because they can accommodate a very big number of students. And also the computer laboratories have been used to serve those students who don't have smartphones. They can come at the university and they can be put in different groups. And then others who can access computers, private computers and smartphone, can stay at home.
Others, the resources you had in place because of your commitment to community engagement that were ready to be engaged once the pandemic took off.
Yeah, I'll comment. I can't see if Leslie wants to comment, but just quickly, like, we did have these really locally engaged centers, and I know a colleague, and Joe Hall is on the line with and you know, his community engagement center and work with the downtown Vancouver East Side, but more importantly, his expertise and the relationships he built. Like, that's the true resources. We are a people business. And I referenced in my remarks about our public square initiative and our Center for Dialogue. Those, you know, having that infrastructure at this time was really critical.
And similar to Joanne, I mean, the centre that I head, the Centre for Social Justice and Inclusion, really all we had to do was pivot our programs for an explicitly COVID-related response. All of the programs and the infrastructure were already there. It was really just a case of, okay, well, we need to focus on this particular moment. So we were lucky in that respect. There was existing infrastructure and program support.
Excellent. And unfortunately, we are running down on time, so we only have time for one more question. You know, I have another question here that asks about, you know, in what ways do you think that Carnegie might translate to other locations in the world? And I would offer Mapendo or Leslie the mic first on this, but certainly I think Verity and Joanne might have a comment about this as well as we tie this session to a close.
I think we might have lost Leslie.
Okay. Well, if either of you want to jump in and share, feel free to as we draw this down.
I think and I'm sure Joanne will have stuff to add to this, is that what's been good about the process is the process of running a pilot in a different country is that you use the American framework to begin with, and that's what the pilot institutions have done. And then you get together and actually, shut your ears, Matthew, but in lots of ways you critique the framework and work out about how does this actually relate to our national context? How does it relate to the way we're funded? How does it relate to the way that the communities we serve? A big issue for both Australia and Canada has been the Indigenous focus. Where is the Indigenous focus in the framework? And how do we make the framework to contextualize the framework for Australia? And the good thing about the way the Carnegie Foundation have let us do that is that we are allowed to have those conversations. It is a flexible framework in the respect that we can make it suit the organic conditions of our country. What I really like about it though, and where it's really helped in Australia, has been the actual definition of community engagement, the reciprocity, the mutual benefit, the for public purpose. We've not changed. And that has actually really helped coalesce the universities. So part of the problem we were having with organising the universities together is none of us could agree on a definition of community engagement. We've locked in behind that definition and then are able to actually have those richer conversations about our domestic context and what we need to change and amend.
Yeah, I would second Verity's comments. I think, initially we thought, okay, this isn't going to work in Canada. We're special as a country. And but we found so much of the Carnegie definition, but going through this process, because you're building on something that's well developed in another country and a willingness to adapt and change it. And I hope some of the changes we make, the Indigenous, the social justice, the co-creation, the trust building, I don't think it's outside of what even the US classification might adapt to in the future. So we've really appreciated the process, and I think it's a good process for any country to work with colleagues across your jurisdiction.
And I think, part of why I wanted to finish there, just to tie it back to the prior questioner's question, I think there's a way, certainly in the US, we've seen that the framework pushes institutions and provides them with the tools to build some of the infrastructure that then they have at the ready when something like the pandemic takes place. I think that's all we have time for today. Thank you all to the panelists who participated and to the viewers of the this slide. It's not a slideshow. It's not a podcast. I'm having a word moment on Zoom, but these happen sometimes. So thank you for being here, and thank you to OSUN for sponsoring and to Telwars for also sponsoring. And I hope that everyone stays safe and healthy. Take care.
Great. Bye, everyone.